Happy Monday and welcome to the end of Q1 for all who celebrate and the beginning of Q2, April 1st. I hope everyone's got a good April 1st Fool's Day joke in them. And here are the things that I'm thinking about as we kick off the week in digital health. So I've got three things that are top of mind. Over the weekend, Bill Gates was published some comments in an article in People. This follows some press release that he's doing around the first in a trilogy that's a memoir of his career, his young adulthood, etc. I believe the book's going to be called Source Code. Anyway, in this article, he talked about the advent of AI and the impact it's going to have on different jobs. We'll get to that in a moment, but the headline is he made the proclamation that AI is going to replace doctors and teachers within the next 10 years. The next thing that's top of mind and directly connected is yesterday, March 30th, is the celebration, the annual National Doctors Day. And I couldn't think of the kind of the best juxtaposition, if you will, than having Bill Gates, one of the most prominent business person in the technology space, talking about AI and the impact on the role of the doctor, coming at the same time that it's the National Day of celebrating doctors and the roles that they play within the healthcare system. And then lastly, those two topics come together, and what I've started to discuss is this concept of unexpected empathy. And what does that mean? And what does that mean in a world that's increasingly artificially intelligent versus humanistically intelligent, if you will? So let's start with the first one, which is Bill Gates' proclamation, if you will. So as I mentioned, and I'll put the picture of his People's article up here and link in the chat. But he over the weekend he was there was an article published in People where he was pontificating, if you will, in terms of where AI was going. This is in the framework of a broader book tour that he's doing around what is the first book of a trilogy that he's guided around his career, around how he built Microsoft, and then how he thinks about the world going forward. But the clip that's going around that's making it circles is he made this proclamation that in 10 years time, that AI, artificial intelligence, would replace, among other things, doctors and nurses. Now, look, he's not the first person to say this. And in fact, there was a wonderful Substack that I read the other day that pointed back to a gentleman, Vinod, who made this proclamation 10 years ago. And more so at the time, he was talking about predictive algorithms, not necessarily artificial intelligence. So the concept that technology is going to replace doctors, among other professions, is something that keeps coming around with each new advent of innovation, if you will, each new advent of capabilities for how pieces of data can be combined together then to make recommendations, to provide advice, to provide counsel, et cetera, et cetera. So the concept is not new. I think what feels new for the world today is the speed and the magic, if you will, that we've experienced around this development of artificial intelligence and how we interact with it, that probably more so than any other time, proclamations such as what Bill Gates made feel real. They feel like, oh, that actually could happen. Not just because we think that it's a possibility, but because we're seeing it. We're seeing the foundations of those concepts actually play out in today's world. I talked about in a prior top three things I think about discussion, a report that came out of Google Research. This is their UK organization, and they had created this multi-agent model to compete, if you will, to be compared against primary care doctors in patient engagement. And I'll point back to that discussion and the research article. But in the research article, what they did is they built this model, and what they they took not a controlled population, but they took a population, a blinded patient population. These were individuals who were paid to act as if they were patients, and those individuals did not know if they were interacting over text with an actual doctor or with an AI agent. And the results that it showed is that both the treatment protocol, the decision making, and the receptivity on behalf of the patients was higher or better when it was the AI model that was interacting versus the actual primary care doctor, the real live human being primary care doctor. So it's articles, it's research models such as that. It's going out and playing with Gemini or Claude, et cetera, and seeing how it gives you this information in a way that is still amazingly unique to appreciate, that makes these proclamations feel like they're real. It feels like, hey, this actually could be a possibility. Not to mention that you have a number of digital health technology companies that are moving incredibly fast in harvesting and using these AI agents to start putting back into the healthcare workforce. Probably one of the most prominent, whether famous or infamous, will remain to be seen in terms of what their success trajectory is Hippocratic AI. And they have largely gone to market saying that their AI agents can be a replacement, not an augmentation, but a replacement for actual nurses in a hospital or in a clinic, etc. And that is part of the value proposition that they talk about with their collection of technology. So what does that mean? How should we think about this? Well, I don't know. I mean, if I were someone graduating college and going into medical school, it certainly would give me pause, among other professions. You could say the same thing for going into computer science, because there's a number of proclamations out there that AI is going to replace the need or replace people who actually do code creation, who are engineers, software engineers. So that the same complications, the same issues that we're feeling around what does it mean for professions like physicians or teachers, or probably the same feelings that people who are going into computer science feel as well with the advent of this technology. But it's hard to know. I think at the most base, what it means is that more so than any other time, we need to be thoughtful about what it means to be human. We need to be thoughtful about when and why the human element should be involved in a job to be done, in a process, and an engagement. Um, we I want the second thing I want to talk about is that yesterday, or the 30th, was National Doctors Day. And how apropos that happened right at the same time that this Bill Gates article was coming out. This day that is a celebration of the commitment, the impact, the sacrifice, and many times that physicians of all types, whether it's primary care, whether it's specialty, whatever role that they may be playing, but the impact, in many ways positive, that they have on health and wellness for the world around them. And that celebration comes at a time when our healthcare system is crumbling from a variety of factors. There was a recent Milbank scorecard report. We've talked about this in a prior episode, that looks at the state of primary care. And a couple of things that it called out is that there are less individuals going through medical school and then ultimately coming out to practice as a primary care doctor. There are less people who are coming out of other aspects of the healthcare system, RNs, LPRNs, et cetera, that are coming out to participate in primary care engagement. And the reimbursement, or more so really the money, the salary, the income that a primary care physician can make is declining compared to other specialties. So we've got the advent of AI, which is being proclaimed as something that can replace, maybe not just augment, but replace the roles that some of these physicians play. We have increasingly less people going into these functions, which is creating this gap, this need that organizations have to solve for. We actually need more primary care. We need more primary care doctors. We need more primary care engagement, is my opinion, to have a healthy health system and have healthy connectivity into our communities. But those are moving at separate spectrums. We're getting less of one thing and more of another thing. And I think it's easy to see why the advent of these technologies is going to very much creep into more of a replacement than an augmentation. Who knows? That leads me to my last point, which is unexpected empathy. And we had a wonderful event with Digital Health KC this past week, where we hosted two panelists as part of the counterweight. We had Matt Wilson, who is the president and chief commercial officer for a local digital health company called Spark Change. They're a phenomenal company. Go take a look at them. And then we had the founder and CEO of a digital health company called Jana, Michael Coggins. Jana is focused on providing technology to long-term care facilities to help them run more efficiently, capture the processes that they do well, and then bill accordingly. And in that conversation, one of the topics that we concluded on was how is AI going to impact both their business and the advent, or more so the growth of how they were serving their respective clients. And we took a moment and we talked about this concept of unexpected empathy, which is, I think, a purely human trait. And what I mean by unexpected empathy is those times where you're interacting with a person. You can think of this in a business setting, in a customer service setting, et cetera, and they have a set of things that they're supposed to do. And you're running up against a wall in that interaction. You're frustrated. You may not have all the things that you need, or you may not know what to do, or whatever. And you experience this moment where, even though they have a checklist of things they say they should do or that they can do, that the person on the other side has a moment of unexpected empathy because of what you're going through, and they take an extra step to help you out. They do something that they normally wouldn't do. They help in a way that is not expected or not part really of their day-to-day job. I think we all benefit from these moments of unexpected empathy. We benefit from them. We give them, hopefully. I think it's inherently a human trait to be able to put ourselves into someone else's place and think about the joy or the pain, the frustration or the obligation that they may have. And because of being able to perceive, to put ourselves into the instance that they're living, to go a slightly extra step to help them out, to provide a moment of kindness, to provide a moment of grace. And the question that we talked about in this event last week, the question that I've been asking colleagues and friends is, what do we lose? When do we lose that in this breakneck speed of AI adoption and development? Now, look, I'm incredibly bullish on both the value and the need for how this technology can impact the world around us. I'm actually in the business of helping organizations understand, navigate, and choose, and then ultimately implement AI agents as an augmentation to their workforce. I think there is a lot of goodness here, but that doesn't mean that we should shy away from the question about what is it about the human interaction that we need to stay true to and balance out as we invest in this innovation. And the thing I keep coming back to is making sure we don't lose these moments of unexpected empathy. Now, the technology innovation pace is breakneck. Every day brings a new development, a new research paper, a new interaction, a new company that's launching something, especially around AI, that could be an augmentation, could be a replacement, that quite frankly is going to turn upside down the world that we live in. And so, as we think about this week, what I leave you with is find those moments of unexpected empathy. Give something back to somebody else. Yes, embrace technology. Yes, lean into the innovation. Yes, think about how it can be form and function within your business, but enjoy the moment of a human connection. And then think about how you can sustain those moments in balance with the speed of technology innovation. These are the things I'm thinking about this week. Look forward to joining. We've got a great episode that's going to be dropping on Friday as part of the Counterweight. It's the live session that we recorded in partnership with Digital Health KC. Once again, our two panelists, Matt Wilson, the president and chief commercial officer for Spark Change, and then Michael Coggins, who is the founder and CEO of Jana Health. Phenomenal discussion, great interaction with the audience. Look forward to getting that out to our Counterweight audience and letting you take the opportunity to listen and interact with it. Have a great week. See you around. Thank you.